Hey guys, my name is Laura. I'm one of the nurses from the NHS, and today I will try to give you some tips to help you with your Band 6 interview. For a senior position, when you are called for an interview, you will be asked questions by a panel. But you shouldn't assume that the panel has knowledge in your specialty, so you always need to use specific examples from your experience to support all of your answers, even if you know the interviewers. So, what type of questions should you expect on your interview? It should be a combination of traditional and competency-based questions. And through those questions, they will be exploring your skills, qualifications, and experience. I have organized this video in 5 main different types of questions you might be asked, and I will explain what the panel is looking for on each question and how to answer each type. Also, you will find on Nurses.co.uk more information to support your preparation for the interview. So the first question could be, can you tell us about your experience until now and how this will support your role as a Band 6? The interviewer is looking for several aspects in your answer. So the first question could be, can you tell us about your experience until now and how this will support your role as a Band 6? The interviewer is looking for several aspects in your answer. They want to assess your previous experience if it aligns with the requirements and responsibilities of the role that you are applying for. They are looking for specific examples that demonstrate your knowledge and expertise in relevant areas of the role. Emphasize your proficiency in clinical skills and procedures that are essential for this position, and highlight your experience working with diverse patient populations and mention any special areas or conditions you have encountered. It's your time to demonstrate your ability to effectively communicate and collaborate with multidisciplinary teams. Discuss instances where you have worked closely with doctors, therapists, or other healthcare professionals to provide comprehensive patient care. Showcase your dedication to patient safety and delivering high quality of care. Explain how you have implemented evidence-based practices and protocols to ensure positive outcomes for the patients. And also, don't forget to mention your learning and professional growth. Discuss any relevant courses, certifications, or conference that you might have attended as you are committed with your professional development. Remember that the Band 6 role involves always leadership responsibilities, so provide examples of how you have demonstrated leadership in your previous positions. Discuss your experience in supervising and mentoring junior staff or students or leading any initiatives. By addressing these aspects in your answer, you can demonstrate that your experience positions you as a qualified candidate for the Band 6 role. Another question, number 2. What do you feel is the Band 6 role in meeting the performance targets? The interview panel wants to assess your knowledge and understanding of the performance targets by the NHS. They are looking for your awareness of key indicators, benchmarks, and metrics that are used to measure and evaluate performance in your trust. But what are the key performance indicators in the NHS? This can include the length of stays, mortality rates, readmission rates, and daycare rates. All of this can be analyzed. So you demonstrate your understanding that as a Band 6 nurse, you play a crucial role in meeting those performance targets. Discuss how your clinical expertise and knowledge contributes to improving patient care and outcomes. Emphasize your ability to identify areas for improvement and implement evidence-based practices and actively participate in quality improvement initiatives to meet those performance targets, and highlight the importance of collaboration and teamwork in the job of achieving those targets. Number 3, as a Band 6, you need to be aware of the CQC. One question could be, do you know the 5 key questions the CQC asked and the outcome of the last CQC report in the department? Choose one of the 5 domains and maybe explain how nursing staff can help the trust achieving an outstanding rating in that domain. First thing that you need to know, the 5 key questions asked by the CQC. Is the service safe? Is the service effective? Is the service caring? Is the service responsive? And if it's the service well led. For the purpose of this response, let's focus on the domain, is the service responsive? Nursing staff can play a fundamental role in helping the trust achieving an outstanding rate in that domain, doing these things. Prioritizing person-centered care, tailoring plans to individual needs and involving patients in decision-making and other healthcare professionals. Promoting continuity of care by collaborating with other providers and ensuring smooth transitions. Also acting as patients' advocates, promoting their rights and addressing barriers that they might face. Contributing to service evaluation and improving through audits, feedback collection. And to finish with this, you can give an example of your daily work doing one of these tasks. Number 4, questions about additional responsibilities or projects that you have taken on in previous roles and how these influence care delivery. Here, clearly, the panel is looking for evidence of your initiative, your leadership, collaboration, and commitment to quality improvements and patient-centered care. An example of this could be being a link nurse, this is a registered nurse who takes on an additional role to act as a liaison or link between the clinical area or ward and various departments or initiatives within the trust. The purpose of the link nurse is to facilitate the flow of information to promote best practices. This will give you extra points for sure. And number 5, always expect an scenario-based questions. In each field would be different, the answer, but in general, what the panel is looking is for a candidate who can demonstrate the following qualities and skills. They want to ensure that you have the necessary clinical knowledge, skills, and experience to perform effectively in the role. So they may assess your understanding of medical conditions, treatment protocols, and relevant procedures in a scenario-based question. They will want to see how is your approach and handle to complex situations. They are interested in your ability to analyze information, make sound judgments, and take appropriate actions in a timely manner. They will check basically your critical thinking and problem solving. Also, effective communication is crucial in healthcare, and the panel will assess your ability to communicate clearly with patients, families, and other healthcare professionals. They also want to see evidence of your teamwork skills and collaboration, as collaboration is essential in delivering high-quality care. The panel will look for indicators of your leadership abilities. They will want to see if you can take charge, delegate tasks, and effectively coordinate care in a team setting. Also, the NHS can be demanding and ever-changing environment. So the panel wants to assess your ability to cope with pressure, adapt to new situations, and remain resilient in challenging circumstances. The panel wants to ensure that you understand and uphold the ethical and professional standards of the NHS. They may ask you your approach to patient confidentiality, accountability, and maintaining professional boundaries. To finish with this video, I should mention that finishing your interview with a question to the panel is always a good option. Some examples could be, for example, what opportunities for professional development and advancement are available within this role? Or what is the organization's approach to continuous quality improvement and how I can contribute to these efforts? Or you can ask, can you tell me about any current or upcoming initiatives or projects that the nursing department is involved? Remember that by asking questions, you learn more as well about the trust and the department, and it will help you to decide if you really fit on the role. And you will also show the employer that you are interested and you care about the role. I really hope you find useful this video, and remember that you can have more articles and videos about this topic on Nurses.co.uk. Thank you so much for watching this video and good luck with your interview.